The ILC is a think tank, and its aim is to help people, whether they're business leaders, policy makers, whether they're campaigners, anybody interested in the future of our society, help them to plan properly for the demographic change that is transforming all of our lives. Well, the ILC is an organisation, in fact a think tank, which is there to help politicians, planners, campaigners, business leaders, everybody, to plan effectively for an ageing society. We do need to change most of our systems if we're really to accommodate the new demography. We need to do this in order to celebrate ageing. If we don't get it right, ageing is in fact not easy to deal with. Our economy is very substantially affected by having an ageing society. Older consumers bring in an enormous amount of income. Even quite frail older people bring in an income because they need care, they need help, they need special food, they need special treatment, and that is all part of the economy. But also, older people can and do work into later life, but still sometimes get affected by age discrimination, and they can't work for as long as they want to and should do. We need to eliminate this age discrimination. We need to make sure that employers train and retrain their older employees so that they can be part of the big economy. The challenge is how health and social care can really meet the needs of a rapidly aging society. Unfortunately, our health service is finding it difficult already because they haven't planned adequately for this, and our social care is funded differently from the NHS on a local basis, and it's extremely difficult to bring the two types of care together. We have to change the way health and care are provided. They must be integrated at a local level so that older people get the health care that they need, whether it's in hospital or in the community. Much more must be done to enable older people to get adequate health and social care where they live in the community. Most older people in hospital shouldn't be there. They should be cared for in their own homes or in a community setting. It's very difficult for many older people who live in houses or flats which are totally unsuited to their needs. They are dangerous, they're cold, they're often damp, they're not designed with the right stairs, the right facilities to enable people to age well. And in this country, people want to stay in their own homes largely, but that's all right if the homes are suitable for them. So we need to look and see how we can make our homes suitable for the society that we actually are. Unfortunately, most people don't think about their income when they retire until they're very near the age of retirement. This is wrong. From a very early age, we should be looking to the future, look realistically at the number of years we are all likely to live. Look realistically at the sort of income we're going to need over 17 or 18 years of retirement at the minimum. Look realistically at how we're going to save enough money for those years in retirement, and try to ensure that we can enjoy those years and live happily and not constantly be worried about money. Sadly, most older people don't think about their future until it's too late, and younger people need to concentrate on retirement funding. Retirement and healthcare funding come together very often in later life. Well, older people are mostly healthy, and if we can increase preventative care to ensure they remain healthy, then we will do a great deal to help the situation. But there are still priorities that are not looked at sufficiently. The biggest challenge for an ageing population is probably dementia, which affects more and more people. They're already approaching 1 million people in this country with some aspect of dementia, Alzheimer's or other dementias. And that needs urgently to have more funding for research and more widely known and accepted research. The ILC-UK is holding a very important conference on the future of ageing. It's going to look at 5 key areas: the future challenges and opportunities of health and care in an ageing society, the future of retirement income, both looking at wealthy pensioners and at persistent poverty amongst older people. It's going to look also at the future of our economy in an ageing society. Very important. How do we adapt our economy to an ageing society? And the future of our built environment in an ageing society. Will there be enough suitable accommodation for people as they age? And the future of ageing research as well. Are we doing adequate research, and will that lead to action to overcome the huge challenges that ageing poses so that we can celebrate ageing? Join us at the Future of Ageing conference on the 24th of November.